Hey guys, welcome back to the channel. Today I'm going to talk about the economics of single-payer healthcare. We're going to learn how our current healthcare system works, or more specifically, doesn't, and I'm going to show you how single-payer could help solve a lot of the worst problems of the healthcare system. There's a lot of moralizing that's thrown around, and there's a lot of jargon that's used. Very little of it is helpful to getting at the true nitty-gritty behind the issues. We're going to talk about that nitty-gritty and a lot more on today's The Delta. So we're going to walk through three distinct issues today. The first are the major players involved in any healthcare market. The second is how the current system is meant to work versus how it actually works. And the last section explains how single-payer healthcare is a system that can help solve for a lot of these problems. In brief, and for our subject that we'll eventually return to, single-payer healthcare is the system in which the government funds all healthcare expenditures in a country. It's not the case that the government takes over all of those systems. That would be a nationalized healthcare system like the National Health Service in Britain, but the government is responsible for paying all of that. And as we'll see later on, that gives it a lot of power in terms of setting how a healthcare system can work for the benefit of everyone. But first, let's lay out the major players in any healthcare system. You've got consumers, or in a single-payer system, citizens is probably the better word. Those are people who are going into the healthcare system in order to get some services that they need, coverage and the like. You have insurance providers of the private healthcare variety, which currently exist and provide the vast majority of care in the United States and in very few other developed countries. You have the government, which currently subsidizes healthcare for both the elderly and some parts of the poor population, but leaves many out to dry. And you have healthcare providers. These are the individuals that either the government or private insurance providers are meant to pay in order to get healthcare services for consumers and or citizens. Now, the current healthcare system is meant to work like this. An individual goes into the healthcare market, a consumer you would say, looking to be provided by some sort of plan. They pay in a steady stream of their income under the insurance policy prerogative that, like any other form of insurance, if they're ever ill or sick, they can expect to get coverage paid for by their insurance provider. Again, in the United States, this is usually a private insurer, but government also plays a role in the form of Medicare for the elderly and for Medicaid in the case of some poor people who qualify for the program. So how is this meant to work in practice? What are the mechanisms that work in order to make sure that everybody is able to get effective care? Well, the main argument that's advanced by the medical insurance lobby in the United States is that competition between insurance providers will encourage them to bid down prices to affordable levels. In so doing, they can help push efficiencies through the system and ensure everybody is covered at a rate that they can afford. In practice, healthcare costs in the United States are the highest in the world, with a 2018 survey from the Journal of the American Medical Association, or JAMA, finding that the US pays more than 2 times more than any other developed nation, indeed any other nation in the world, on its healthcare. The only exception to this rule is Switzerland, and they actually run a similar private-based system to the United States. For other countries that indulge in the inefficiencies of government bureaucracy, like Japan, they can expect healthcare costs that are more than 4 times less expensive than what we pay here in the United States. And all that, of course, is great, but we, of course, through spending so much money on our healthcare system, can at least expect to live longer. That's not true either. The Japanese outlive us by almost half a decade. So, it's clear that the current system doesn't work, but what are the specific reasons why it doesn't work? One of them, as I've mentioned before, is a lack of competition between healthcare insurance providers. Another is a unique product of a largely private insurance market-driven system. This is known in economic jargon as the ability of insurance providers to price discriminate. Now, what does price discrimination mean? In brief, if you have a single market where everyone is competing on the same level playing field, you kind of have a law of averages at work. If insurance providers want to be effective and want to compete, then they're required to bid down the price of their insurance to levels that match with other individuals. However, in a system where not everybody is in the ballgame and not everyone is even able to afford coverage, insurance providers are given a lot more leeway to isolate certain individuals and discriminate. Before the introduction of Obamacare, this was particularly done on the basis of pre-existing conditions. What does that mean in practice? It means if your insurance provider knows that you're a diabetic, or if they know you have another pre-existing condition, they can charge extortionate rates in order to justify providing you healthcare. And because other providers know that you have the same condition, they will all charge that exact rate. The sum effect is this. If you have diabetes, you're basically screwed in the current system. It's just a matter of which insurance provider is going to do it. So that's price discrimination, a unique product of a largely private-based healthcare insurance program. Another major issue for literally millions of Americans is the reality of no healthcare coverage at all. In a healthcare system where the government does not mandate that everybody receive care, the United States currently sees more than 28 million Americans have no healthcare provided at all. This has a number of knock-on effects, but recall this. Despite the fact that there is an individual mandate baked into the Affordable Care Act, which demands that everybody receive insurance, the reality is that for most, the economics still does not add up. They're willing to eat the fees that are associated with not having healthcare, rather than accept the onerous rates and onerous prices that are foisted on them by private insurance companies. In fact, because there are so few options, this becomes a regularity for many Americans, and doesn't allow another major problem of the American healthcare system to be solved. This is the reality of the benefits of preventative care. You see, where private insurance companies are concerned mostly with profit, they're likely to increase the deductibles, that's the amount you have to pay to get healthcare services, to levels which prevent you or discourage you from seeking out medical attention. Now, for the private insurer, that's the rational move. They want to keep you from using insurance where they can, and foist as much of the costs off on you as possible. But if you're an individual who's feeling a bit ill, maybe has a lump somewhere in their body, or something that they might want to get checked out, that economic necessity will keep you out of the hands of medical professionals who could diagnose that lump as lymphomic cancer or breast cancer or something of the like. That is a cost for everybody, because rather than nipping that in the bud early on, which is the natural consequence of preventative care, we literally have to wait as a society until you collapse or become infirm and are taken into the hospital, often not even by your own choice. That is the nightmare of the American healthcare system today. And it's that very same necessity that eventually brings you into the hospital that I think can be seen in a more holistic sense as prefiguring a lot of conversation about healthcare. Healthcare, at the end of the day, is a necessary good. In economic jargon, it exhibits one property that's very important to note. It's inelastic. Inelasticity in the economic literature means that the amount of a good that is demanded is not meaningfully responsive to price. In practice, that means if you've got a condition and you need to see a medical professional, at the end of the day, you aren't really going to be able to quibble about the price. It is literally a matter of life and death. Insurance providers are willing to charge you whatever they want in order for you to get that care. This leads to the uniquely American tragedy of GoFundMe pages and mass medical debt. To be blunt, this is a problem nowhere else in the developed world but the United States. And it's things like this that a single-payer system could fix. So we've seen a number of the problems in the current healthcare system. We have price discrimination and price gouging. We have the outright abuse of people with long-term medical conditions, which was only partially ameliorated by the Affordable Care Act. We have insurance companies that don't compete with each other and jack up rates on everybody else. And we've found that these systematic problems should surely demand a systematic response. Well, let's go back to the major actor that we mentioned before. If private insurance systems are providing a lot of these problems, if they're not covering people, they're charging people too much, and the like, then perhaps government could provide a better solution. Indeed, this has been what most governments have done in the aftermath of the Second World War in the developed world, with the exception of the United States. It was actually in the early 1950s a plank in the platform of Harry Truman in his Better Deal that universal healthcare would be on the menu, just as had been put there in 1948 by Britain's National Healthcare Service. So now that we've seen the problems of a single-payer dominated insurance system, one might logically ask the question, why doesn't the government run this program? Why is it that taxpayers, as citizens, don't pay into a collective insurance fund that covers everybody? Well, if you're a member of the Republican Party, that's because this is socialism, and we all know the horrendous effects of socialism. Social Security, Medicare, Medicaid, two solutions already in the same mold. Those are all going pretty well. But really, what is the reason for it? There's got to be something even behind the rhetoric of the major political parties. The answer has actually been in front of us all along. It's private insurance companies themselves. This system, which doesn't provide good care and provides at a much too extortionate rate and leaves millions of Americans out to dry, is actually pretty profitable. Unfortunately, the very nature of exploitation is both that it produces problems and also is self-reinforcing. Private insurance companies are amongst the largest lobbyists in Congress today, and therefore any move to a single healthcare system that would put them out of their market share is going to be vigorously resisted. It is quite literally their direct economic interest that these problems remain problems, and single payer is the most dangerous solution, not because it doesn't work, but because it would. It would work first by bringing the 28 million Americans who aren't insured at all into the fold of the healthcare system. This would both provide them the immediate benefit of getting healthcare services, as well as provide the collective benefit of preventative medicine for millions of Americans. It would also allow the government to exercise something which it has not meaningfully done before: monopsony power. Monopsony power is something that isn't talked about nearly as much as its cousin, monopoly power. Monopoly power exists when there is only one seller of a good in a system. The idea goes because that one seller is able to dictate the terms in which everybody else buys from them, they can set the price. Well, there's actually the opposite relation, when there's only one buyer of a good, and everyone who sells the good therefore needs to meet the standards of that buyer. That is monopsony power. The government, as the monopsonist, would then be able to control a lot of the rates at which healthcare is provided, cutting down on the excess rates of the insurance premiums and cutting down on excess costs of production in the healthcare system writ large. In other words, the government would be able to straighten out the costs that have accrued across the healthcare provision system, from the original point of care to the insurance premium and the like. Furthermore, there'd be an incentive to hold the politicians responsible for this program, in the same way that they're held responsible for perhaps the single biggest voting issue amongst elderly Americans, Medicare. Medicare is a direct economic incentive for the elderly. When they come to the polls, they expect politicians to protect and expand that system's services. With a single-payer system, the direct mandate would be on the government for all Americans, and it would make it the same sort of political keystone that the NHS is in Britain. The NHS, famously known as the religion of the British government. These are some of the major benefits that can be expected: full care coverage, more expansive provision of preventative care, the eradication of a reliance on healthcare coming from one's insurer, and all of these extra things could come at simply the cost of integrating the healthcare system from the US government's perspective, rather than those of private insurers. Tellingly enough, in the same Journal of the American Medical Association survey that I mentioned earlier, the authors noted that though costs of healthcare in the private insurance market had continued to skyrocket, they had remained relatively flat in the public sector. Tongue-in-cheek, they simply noted, if the former wants to get costs under control, which under the current system is the healthcare costs for the vast majority of Americans, they could maybe take something out of the pocketbook of the latter. They could expand care and expand the nature in which healthcare is provided along a public option line and along the lines of a single-payer system more generally. I think perhaps one of the funniest things that comes out of all of this is the fact that the market system, which is what the private insurance companies are always extolling, actually produces some pretty horrendous inefficiencies in terms of the amount of administrative costs that are mentioned. The same survey noted that while current administrative costs take up almost 10% of all of the costs of even providing healthcare in this country, in other government-run systems that number is between 1 and 3%, providing more bang for your buck and eradicating bureaucracy by getting rid of the market. All of these things are important to keep in mind: the importance of expanding care, the importance of reducing prices, both to reduce the amount of cost that healthcare provides overall to the US economy, as well as to bring it in the reach of affordability for those who can't currently pay in. Additionally, the importance of eradicating price discrimination and equalizing costs and the opportunity to be able to see access to healthcare services. But at the end of the day, and I promised I would keep this to the side to the very end, there's a profound moral claim to the importance of providing healthcare to millions of Americans. It affects your pocketbook, but it also affects your heart, literally as well as symbolically. Hey guys, so if you liked the video, feel free to smash the like and subscribe button. I'm always happy to hear about the comments that you have on these, and we're really enjoying the work that we're doing here. So by all means, if you have comments, criticisms, if you want us to cover other topics, feel free to reach out, and thanks again for watching.